So now that we have done we have got to know the foundation about this. Now let us see this thing in practice. So in today's demonstration, I just want to look at 4 different areas. I wish I can do, I actually have 29. I actually have more, about almost 70. So I picked out 29 case studies, but it's practically not possible for me to teach all 29 case studies here. So what I want to do is to do a few, at least 4 in this demonstration and the exercises that we are going to do. Okay, so watch it, then of course try it. So let's see. We said drug information uh, uh, assistance, right? Okay, so I will just go online. I will go to, let me look for, okay. I'll open ChatGPT, for example. So let me start with a new chat. All right, this is a new chart I'm starting with. So we're talking about drug information. We're talking about drug information. So what do we want in the drug information? Um, where are we? Oops, no, it's not it. It's the wrong tab. Okay, this tab. So we're talking about drug information. Okay, let's just do a few queries. I'll just do random practice. By the way, before we go on, I want to do something. I want to teach us something because it's the foundation for us getting the best of AI. Okay, it's the foundation for us getting the best of AI. So I want to teach us just briefly. Let me teach us briefly what is called prompting. So let me share that screen. Let me teach us prompting. Okay. Let me teach us prompting. Then from there, we can go and do practical so that you understand it. You don't just jump on AI just like that. Okay. You don't just jump on AI. So there's what you call prompting. Prompting is how to converse with AI. How to converse with AI. Okay. So I used to give this example. I say, and it's common among African mothers. So a mother sends a child, go to the kitchen, bring a cup of water for me. The child goes to the kitchen, brings a cup of water, but the mother is having a conversation with someone and says, Mommy, here's the cup of water. Where do I keep it? Then the mommy looks at the child and say, put it on my head now, which was sarcastic. Okay? But the child, being an innocent child, does not know what sarcasm is. So what he does is picks the cup, takes the cup, and drop it on the mother's head. I'm sure you know the implication of that action. Okay? The implication of our action is that child will go in for it. He will suffer some some consequences, right? Okay. So the same thing with computer. And I'm sure we have had garbage in, garbage out. So the same thing with prompting. So if you want to prompt properly, there are some 4 different things that you must pay attention to. 4 different things that you must pay attention to. The first one is role. So when we talk about role, hold on a moment. When we talk about role, we are talking about what is the best. Okay, I think I have it in my slide. Okay. Okay, let me just continue. Role. Who is the best person that can do a particular thing? Who is the best person that can do a particular thing? So you are giving it a kind of personality. So let's look at it. If you are talking about anything that is legal, that has to do with legal, who do you want to talk to? A lawyer, isn't it? If you're talking about maybe anything electrical, who is the best person to talk to? Maybe an electrical engineer. If you're talking about business, who is the best person to talk to? A business coach or consultant. If you're talking about pregnant women, Who is the best person to talk to? An obstetrician, right? Okay. If you're talking about drugs, who is the best person to talk to? A pharmacist, right? So do you see? Imagine now that you are asking an electrical engineer about drugs, or you are asking a lawyer about pregnancy, or you are asking an obstetrician about business, or just go to the street and see somebody on the street and say, please, what is the side effect of chloramphenicol? Or you see somebody on the street and say, please, my television is having sparks every time I put it on. What do you think is the problem? You don't want to do that. So when you go on AI and ask it questions direct, you are talking about pregnancy or about business with somebody randomly who may not have the capacity. Of course, there will be an answer they are going to give you, but the person that will give you the best answer is the person for which it is suited. So you see, that's where role comes in. Very, very critical. We're going to see it in action. The next one is context. Context is talking about background, purpose, etc. So why? This question you are asking, who are you asking it? So you also include audience. Okay, who are you asking it for? Who is going to use the information? Why are you asking it? What do you want to use the information for? Everything that gives context. Okay, so for example, now I said, I come to a pharmacist and I said, please, I need a contraceptive. I'm a man. I come and say I need contraceptive. The person will look at me, who wants to use it? But if I come and say, please, then again, there are other questions that you want to ask as a pharmacist about whatever. But if I come and say, okay, I need a contraceptive for my wife. She takes so and so, this recommended for her, and this. What we have is finished. Giving you that information makes it easier for you to attend to this person and give the best advice. Or you say, my wife is using a contraceptive and she's bleeding. No information, using a contraceptive and is bleeding. How can you give advice? But if you say, my wife is using maybe level plant, and now she has been using it for some time, but since her last implant, she started bleeding. So now you have context. Do you get it now? He has come to you as a pharmacist. Now you have context. So that is background. If you have the background, if you give AI the background, it's going to give you the best of result. Okay. After background, the next one is task. In actual fact, the task is the thing you want to do. So let me copy it. Let me cut it even and bring it to the first, because that is the reason for which you are even using AI at all. What you want it to do for you. That's its task. That's even the main reason why you're using AI. What do you want it to do? What you want it to do. Okay? What you want it to do. That is the task. So, and the task could be what? Drug interaction, patient counseling, pharmacy, business advice. Okay, these are tasks. Write email. These are tasks. Now, you can come to ChatGPT and say, write an email, and you can write any email. But so that you can get the best of these tasks, that's where this role comes in. Okay, you say, okay, act as a business consultant who has worked with pharmacy business for over 25 years and has helped them do this. Write this email to so and so, maybe to task, not task, maybe Smedan. Okay, something like that. So you see, you are giving a personality. And now, the context now, you describe what is the purpose of the email. What do you want to achieve with the email, and so on and so forth. Okay, so these three, we have done three. The last one, of course, there are many. This last one is an encompass of many things. So here we have what is called format. Okay, this format will talk about the tone. We'll talk about the constraint or limit. it talks about how do I call it now? Structure, length, and so on. Okay, yeah, structure. You want it in paragraph, length. That's also limit is also related to length. Okay, I will put that together. Then even voice. Okay, so you want to tell it in what format to write in Yata file, including language. All those ones fall under format. This is very key. The reason why I'm bringing this is if you're able to communicate with AI better, you are going to get better results. There are people that have said, I told AI to write a post for me, but what he returned is not what I want. Or you want to create an image and does not give you the right return or what you want it to create. It is because your prompting is not good enough. Okay, so tone. Do you want it to be friendly? Do you want it to be sarcastic? Whatever, humorous or whatever. Constraint. How many paragraphs? Do you want bullet points? Do you want it to be 100 words, 500 words? Do you want it to have different headers and everything? The same thing with structure. Do you want headers? Do you want sub-head? Do you want whatever? Then do you want voice? What do you want to talk as an authority? Do you want to talk whatever? Okay, language. Do you want it to speak, write in pidgin or whatever? English, Yoruba, Hausa, and stuff like that. Now, when you put all these things in your prompt, the output is going to be very powerful. Okay, it's going to be very powerful. Now, let's explore it. Let's explore it. So now I want us to start with. I'll just do um uh a general one. I will say write um uh what would you advise? I'm doing a general one. Advice consider for a patient on warfarin. Okay? What will you advise to consider for a patient on warfarin? This is just plain. Okay? So let's see what it's going to give us. So if you see what he did now, for a patient taking warfarin, the biggest issue is balancing the risk of bleeding with the need to prevent blood clot. Warfarin is effective, but it's one of the medicine that require most monitoring. This. So you see, it gives regular. So what it's giving you is normal educational. Okay, normal educational. I'm bringing this from my head, so some of the things may not. It's just giving general advice. So I will just think of something. I just did it off my head. Okay. But if I want to write a proper prompt, I will say act as an emergency pharmacist. Okay. Emergency pharmacist already means that you work in ICU. Okay. Um, a patient is brought in um, unconscious. Okay. Brought in unconscious. I found that he is on warfarin. Okay. And he uh, became unconscious. So you see, I'm just bringing from my head. Unconscious due to a fall. Okay. Um, can you identify the likely causes? What I should be concerned about? questions to ask, and treatment recommendations. Um, to give. Okay. If your response in let's say bullet point. Okay, so let's look at it. As an emergency pharmacist, this is showing role. Okay, a patient is brought in unconscious. I found is on warfarin and he became unconscious due to a fall. This is the background. Now, can you identify the likely causes, what I should be concerned about? Question to ask, recommendations to give. This is the task. This is what you want you to do. Then see this one. Give your response in bullet points. That is format. Okay? I can also say, make it professional. Okay? So let's see what it's going to give us. See, the first one is just straight, because we are asking what to consider for a patient on warfarin. But this one, we have given cons. So immediate clinical concern on a question patient in fully having intracranial hemorrhage until proven otherwise. Okay? So likely causes, intracranial bleeding, massive internal disc. You see, giving you all these things that you should consider. Immediate concern, airway compromise, expanding intracranial. We know that this is more of a emergency medical response. But I mean, I'm just trying to make you see what is possible, because you may also want to give advice if you understand all this. Okay? Now, what is the immediate assessment priority? Airways, breathing, circulation, disability, exposure. Do you see how deep it has gone to bring those areas, which ordinarily, perhaps you don't have the experience in that area, you may not think about it. Now, critical questions to ask. Why is the patient on warfarin? What are the conditions? What dose? What is the last dose taken? And all those things. You may get this information from the caregiver. Okay? Recent medication history, fall history, and so on and so forth. Then we'll go to recommendation. Reverse warfarin immediately. Administer for factor prothrombic concentration urgently, and so on, plus intravenous vitamin K. If you know it's already bleeding and the patient is already on warfarin, do you see it now? So if PCC is not available, fresh frozen plasma, you see, it has given you how to go about it. Avoid NSAID, antiplatelet, and so on. So do you see how you are able to have clinical support? Clinical support using AI. I don't know if this makes sense to you. So do you see how quickly he's able to bring this? Now, there are a lot of things that he gave here that you may not have considered. There are a lot of things that he gave here that you may not have considered. Okay? Now, this question also has something. There's a context missing. I will now say, note that because some of the things he's going to recommend may not be available in Nigeria. Maybe because we didn't tell him that this scenario is in Nigeria with limited resources. So you see, I've given you a new context. Now he's going to look at this, my current context, and give me the appropriate advice that I can use in Nigeria. Okay? Because I'm saying in Nigeria emergency setting with limited resources, an unconscious patient after a fall should be presumed to have, of course, the same case, severe traumatic brain injury, possible shock from internal bleeding until proven otherwise. Practical, what to do? First 5 to 10 minutes. Of course, similar things. But let's go to where he's talking about medication. Okay? Now, it is going to change one or two things. Investigation required. If you go earlier, there are a lot of investigations that were mentioned. But here, it has reduced to a few because it's looking at your situation. Urgent CT scan. If CT scan not available, of course, continue as intracranial hemorrhage. Then recommendation, stop warfarin immediately. Reverse anticoagulant. PCC plus this. More realistic in many Nigerian hospitals, fresh frozen plasma if available, plus vitamin K injection. So do you see? additional. So do you see how I was able to change the context and it gave me what I want? Okay? This is AI helping you with clinical support. This is AI helping you with clinical support. Okay? So do you see how these things work? Right? Okay. So still talking about clinical support, we are, let me check, there's a case study that I want to share. So let's do this case study and do a medication review. Okay, I'll place this. So this is a case of Mrs. Adeze O, she's 7-year-old, diagnosis and this and this. Okay, now we want to find out. Okay, identify any issues with this case. Okay, now, of course, metformin. Okay, we see a case of type 2 diabetes. Of course, metformin is indicated for type 2 diabetes. Okay, lisinopril is indicated for hypertension. How about this condition, the chronic kidney disease stage 3? Are these to go together? Is there any other area where there is interaction? Ordinarily, you should be able to identify this. But it's possible that there are more things that we didn't consider. So we have said identify issues with this. And this can be done in seconds. Okay? All right. So see, key clinical issues identified. Likely, of course, there was the issue of cough, persistent cough, or rising creatinine. Rising creatinine, of course, is a result of the kidney situation, right? Okay. So likely ACE inhibitor induced cough, like lisinuril to cause drive cough or whatever, can significantly affect adherence and quality of life. Okay. And it's more common in elderly patients and females. So do you see now? This is a reminder of what you have learned in school. It brings it up quickly. Even though what is quickly going to come to our mind is lisinopril, persistent cough. But see, it has gone further to give us this information about elderly patient and female being the more people that are prone to this adverse drug reaction. Okay. Now, recommendation: assess the nature of cough, the duration, and everything. Consider switching to maybe losartan or valsartan. Then rising creatinine showing what is a major concern. So she has what? Stage 3 kidney disease, chronic kidney disease, diabetes, hypertension, and everything. This rising may indicate progression of the kidney disease, the ACE inhibitor-related renal function decline, and so on and so forth. So what is it saying? Remember, it has already advised. Now, this is even giving it further explanation, which one way is you either reminding yourself or learning afresh again. You must have learned it in school, but it's because no two cases are the same. You just have to look at everyone in his own merit, but it's giving you this one, which could be a learning for you. Okay? And see, dehydration would be an issue. So it's trying to, the causes of the rising creatinine, it could be the ACE inhibitor that is being in use, or there could be dehydration, or it could be diabetic nephropathy. Remember, the person already had kidney issues. Okay? Then undisclosed NSAID use, which is very common in Nigeria. See what you wrote. Very common in Nigeria. Okay? People use NSAID anyhow. Right? So when you put this one together, it can create more problem. So let's look at metformin used in CKD. It needs review. It's inappropriate depending on the test that you have done. Okay. Now, so what is the risk? Metformin accumulation, lactic acidosis, and especially there is this. So do you see what it has done? And what did you go for that to say? Recommended action. Check the lab result. What is the level? Then aspirin use should be reassessed. It could lead to bleeding, renal perfusion, and so on and so forth. High cardiovascular risk, and so on. So do you see in how many seconds this result has come? You go through it quickly, you have information, you marry it with your own information that you already have, and you can give necessary advice. And what is the advice? So this is summary. Possible this, Earlier, he gave advice to replace lisinopril with losartan, or which other one did he? Or vasartan. Okay. So do you see how it has also helped you with medication review? Right? It has helped you with medication review. So this is how AI helps us in our work. Okay? It helps us in our work. Now, question we should ask ourselves: do you see how quickly we are able to get results, right? How quickly we are able to get results. If, for example, we did not use AI, how many of all those things can we actually capture? All of them. How many can we actually capture? Right? How many can we actually capture? We can capture something significant, but can we capture everything? Can we? All right. So we have seen for clinical support. Now, which other area can we use? We talk about patient engagement and patient education, right? Now, there's something. I created a tool. Let me check. Can I find it? Yeah. Uh, just give me a second. Let me look for this tool. Uh, Just give me a moment. Okay. I created something. Okay. It didn't really work as expected. Just wait a moment. Uh, where are you? I'm trying to check. Aha. Okay, let me open this other one too. There's something I created. All right. So let me show us this tools. Let's go to our browser. I created some tools. This is supposed to help us with uh, counseling, right? Um, I don't have the API, so it didn't give me as much result as expected. But let's look at it. I'm trying to show us what is possible. Now, this tool is not fully created. I name it RS Counsel AI, okay, pharmacist assistant. So we are looking at how to build a counseling guide. So you input information and quickly it gives you a counseling guide so that you can quickly counsel your uh, patient. So let's use this metformin. Metformin. We are using it for type 2 diabetes. The patient is a pregnant patient. How do you want counseling to be? Very simple. What language do you want it to use? Let's say simplified English. Then do you want simplified medical language, include lifestyle and everything? So you click generate counseling guide. Now, like I said, I did not use any API, right? So it's not able to give me the actual information that we need. Okay, it's supposed to give particular information like this important precaution, but I did not use an API. So that is disclosure from the very beginning. But look at this. I put that information, this information that I put, generate counseling guide, and see what it gave me immediately. Okay? What is this medicine used for? When you are counseling, what do you discuss? You take them through all those things. So what is the medicine used for? How to take the medicine? What are the important precautions? Now, if I use API in creating this tool, it will have given me the actual precautions I need to take note of. What are the common side effects? Okay. What are the lifestyle modifications that are required? What's the adherence advice I can give? Okay. Now, what I just want to show is, you see, I just imputed this simple information, and when I just hit this generate, in a few seconds, it has given me, and I can just go ahead and speak to the patient. Okay. So I just shared this so that you know that you can also create these tools for your own use using AI. It shortens the journey for you. Okay, it reduces all the stress of overthinking. You don't have to begin to. There are some times that you may need to consult official books. You may not need to do that. But when you are creating this kind, please, you need to use API, and you are going to connect it to actual repository of drug database, or rather, a drug repository or a drug database. I didn't do this one. I just created this one just like that. Okay, all right. I just wanted to show you what is possible. Now we talked about uh, what's it called? We talked about patient education, right? Okay, so let's let's go to Claude. Let's go to Claude. I want to use under tool Claude. Okay, so I have this uh, prompt already. So this time around, let's use what drug can I remember again? I'm not dependent. Okay, I'm loading pin for a 45-year-old with uh what do I put now? Hypertension. Let me just hypertension. Yeah, of course, that's what hypertension patients in Nigeria use simple grade 6 reading level. Cover. What are you going to cover? What it's for, how to take it, what to avoid, and everything. Then write the key points as 5 bullet points suitable for patients with low literacy. So I want to create a patient medication information leaflet. So I'm using Claude now to create it for me. My problem with Claude is to go ahead and create the actual document itself. So it's going to use my credit, and that's not what I want. Anyway, so let's go on. Let's wait for it to do that. So it's going to take its time. That's one thing about Claude. Claude will take its time to come up with this. If it is ChatGPT, it will just give you on this. Now, one advantage also comes with Claude. This is another AI tool. Many of you are familiar with ChatGPT, which we used earlier. This is Claude. Claude has some very powerful capability. You see the PowerPoint that I'm using now was created using Claude. And this is a very beautiful thing. There are other tools that can create PowerPoint for you, actually. Okay, but this is a very powerful one. So why this is taking time to create, let's wait for it to create. Another thing we want to do is still part of patient education. Now, one of the ways of creating patient education is to create maybe flyers, right? You to create flyers. And if you want to create flyers, you will need to, how do I put it now? Be artistic to an extent, right? To be artistic, to know how to draw or whatever, right? But we don't know how to do those. So what are we going to do, right? What are we going to do? We'll go and use another AI tool to create it for us, okay? So it's loading. Okay, it has loaded. So do you see now? See how beautiful it is? Okay, how many pages? 3 pages, right? Aha. So you see, the leaflet tells you about your medicine. Read it carefully, keep it safe so you can read it again and again. So you created this one. You can even give it to your patient to go on with it. Okay? So can you see what is amlodipine and why do you need it? Amlodipine is a medicine that helps lower your blood pressure. It belongs to a group called calcium channel blocker. Your blood pressure is the force of, it's explaining all those things. I didn't want all these details. Okay, but I mean, this is something that your patient can go home with and take his time to read, even if you're not able to explain everything to him. Even if you explain to the person and you give this to the patient can now also have time to review whatever it is that you have told him or her. Okay, now let's go back to our ChatGPT. I will say, I want to do the same thing. I want to do something. That's why I'm bringing. I want to copy this again. So let me copy it. Let me go back to ChatGPT. I'll just paste it here. So let's see what ChatGPT will give us. I want to do something else. I'm not going to go through all that. ChatGPT will not give you that design, okay? But it will give you something. So you see how it present is used to treat this, okay? And here we are. How should I take it? And all the things to avoid when taking it, possible side effect, and so on and so forth. Okay. Now, let's say my patient is Hausa and you translate this to Hausa. Okay. So it means that you can still serve your patient. So let's assume you are Igbo from the East, but you are in Katsina as a maybe a core member pharmacist or even a full-fledged pharmacist on special duty or whatever. Okay. And now you need to talk to them. You don't understand anything in Hausa apart from just the greetings. How will you explain amlodipine to a Hausa man who does not understand English? Maybe he doesn't understand pidgin English. So do you see? That's changed for us. Amlodipine, Magani Hawanjini. Hawanjini means hypertension. Magani means drug. So Magani Hawanjini means medicine for hypertension or high blood pressure. Hawanjini means high blood pressure. Okay? So you see, me wannan magani yake yi. Amlodipine magani ne da ake amfani da shi wajen maganin hawan jini. Yana taimakawa rage hawan jini, rage nauyin kan zuciya, rage kare kadaya, whatever, that is stroke. Okay? So you see, it has explained it. Now you can, your outside patient will look at you and say, this my, what's it called? My pharmacist is very, very good. So that I don't sound okay. Don't worry, I will use Yoruba in another place and Igbo in another place. So do you see this language translation? Okay, you see how AI is making it easy for you to get things done. Okay, now we talked about what's it called? We're still talking about patient education and want to do visual enlightenment. Visual enlightenment. So for visual enlightenment, for example, we want to talk about say pigeon. Want to use pigeon for this? Okay. So I want to create a flyer. Okay. For this, give me a pigeon English version to use on my flyer. Okay. So let's see what it's going to give us. So of course, hypertension medicine. What's in this medicine they do? Okay. Now I can use AI, ChatGPT, to create this flyer. Okay, so let me even go ahead and just ask it to do it. What is this? Okay, it's layout it created. Let me tell it. Design the actual flyer. Okay. So I'm giving instruction to design the actual flyer. Let's see what it's going to create for us. What are you doing, Mr. ChatGPT? You have started code. let me copy it and try it on another tool. Let me see preview. Oh, okay. Look at it. It used HTML to create it. Look at it. So it has created it, but this is not colorful. I will go back to it and say, let me give it another way. I'll say, give me a prompt to create a flyer. So if you notice, I'm not giving in all those my process because I'm just rushing. I don't have all the time to do that. Okay. Okay. Give me a prompt to create the flyer. Okay. Include images. I want to say realistic images. Because if I say images, can put cartoon character images, realistic images, okay, to explain each part. Okay. Aspect ratio 4:5. Okay, let me just leave this. Let's see what it's going to give me. So I'm using free version, and I intentionally using this because a lot of people don't have access to the paid one. I have a paid one on another browser here, which does a lot of things beyond what this free can do, but this is more than enough. All right. Okay, so it has given me this. I will go to another tool. Okay. No. This tool. Here is a tool, Gemini. Now you see I'm crossing from one tool to another. But I've not gone to 30 tools here. So far, I've just done only how many tools? This is the third one we are coming to, right? Okay. So I want to create an image. I'm going to choose the pro version. Then I'll paste the prompt I got from ChatGPT. Okay. And I can do this on Canva too. Okay. So I will delete this. It's not part of the prompt. And I will go up. This way the prompt starts. So anything before that time, I'll remove it. Now, this same prompt, let me copy it. It won't give me a expected result in other tool, but let's see. So this is Nano Banana. This is from Google Gemini. It can give you pro for like 3 or 4 designs before it goes to fast. Okay. So if it says you have exhausted your pro, you can come here and change it to fast, and it will also give you a good result. This is another tool. It's called Ideogram. Ideogram is very good, but it cannot take a lot of text. If you have a lot of text that you want to create, use Gemini, or use Notebook LM, or use what's it called? What's this called? ChatGPT images. Okay. All right. So I'll also place it here so that you can see what it's going to create for us. Okay. Now we are still at the level of patient education, right? Okay. Got it. So I'll paste this here. I chose 4:, let me use this one. Okay, so I've pasted it here. So let's see what this one is going to generate. Now, this tool is called Ideogram. Ideogram. See what has been created using Ideogram. Several things. Can even use to create logo. See these pictures. They look realistic, isn't it? Can put cartoon. You can create anything. All right. Okay. If I click on this, my images, you see a lot of things that I've created before now. But that's not the purpose of this call. So I've pasted it here. Let's see what it's going to generate for us. So it's going to create 4. You can choose one of the 4. But let's go back to, where is it? Gemini. Good. See what Gemini created for us. So you see what it created for us. Remember I said use realistic images. These images are almost realistic. They look human. Okay, this is the patient. This is the doctor, right? Amlodipine eye blush medicine. What it is for. You see the heart. You see explanation. You see how to take it. You see 1 tablet once daily. Okay. So see this. What to avoid. The side effects. When to go to the hospital is put danger color, red. See, health tips that could be helpful. Always follow your doctor or pharmacist advice. So do you see, we have created a flyer, right? Can you see? This is quite good, right? Now you could do it better than this one if you create the flyers. If you know, I did not take time to do all those things. I've already taught you how to do prompting. You want to put all those into action to get the best result you can get, right? Okay, let's go to Ideogram. What did Ideogram give us? Oh, it's still generating, but it's completed. Okay, let's see what Ideogram gave us. Okay, this is what Ideogram gave us. Okay. My problem with Ideogram is that when the text gets too plenty, it gets confused. So it works with just fewer amount of text. Okay. it does not do plenty text. That is challenge with ideogram. So you see, it gets confused when the text are too plenty. So you are better off using ChatGPT. Let me put the same prompt on ChatGPT and see what it's going to create for us. Okay. So you see, this will help you with what do you call it now? With your patient education. All right, it will help you with your patient education. So you could see a while ago, it told me that I have I'm adjusted my free. I'm using the lesser this thing because this is free. Okay. If I open another browser where I have the paid one, I can do as many images as I want. Okay. I can do as many images as I want. So that is how this tool works. But the free can do quite a lot for you, right? Okay, so as you can see, it's creating an image for us using that same prompt that we use here, not here, here, and also here. So let's see what ChatGPT will give us in relation to that. So we have seen patient clinical support. We have seen patient education. In what other area? We are doing flyers now, which can be used across several different areas. Okay. So which other things can we use AI for?